Welcome to AdventHealth Transplant Institute at Porter. Thank you for joining us today. We'll begin with your education session. The goals for today's evaluation visit are to learn more about transplant and the process of being evaluated, to learn more about the wait list, to get to know our team, and for the transplant team to get to know you and to better understand what questions and concerns you may have. Getting a transplant is a big deal, so be sure to ask questions. Please write down your questions during this education video so we can answer everything throughout your visit today. Your transplant team consists of multiple different members. They all have different areas of expertise in caring for transplant patients. Your nurse coordinator today will navigate you through this appointment. You'll meet with a social worker, a dietitian, and a pharmacist. You'll meet with a financial coordinator, and you'll also see the surgeon and the hepatologist, who sometimes work with nurse practitioners and physician's assistants. Any consulting services that we send you to, for example, like cardiology, pulmonology, or infectious disease, will also become part of your team, and you are in the middle. You are the most important part of the team. To give you an overview of what each team member does, you will be assigned a nurse. She is your transplant coordinator. She will help be your main guide throughout the transplant process, making sure tests are ordered and that you're completing the testing required for the evaluation. The transplant social worker will provide education on the support required before and after the transplant. The transplant hepatologist and transplant surgeon will evaluate the medical and surgical aspects of your candidacy and will perform health assessments to determine if you are deemed an appropriate candidate for surgery and lifelong immunosuppression based on your past medical and surgical history. The transplant financial coordinator will help you understand your medical coverage benefits and the expenses that are expected to come with liver transplant. The transplant registered dietitian will evaluate your nutritional status and your physical strength, and the transplant pharmacist will review your medications and advise how they might change during the transplant. Transplant is not right for everyone. We always want to make sure the benefit of the transplant outweighs the risk to you. We will not offer transplant with anybody who has ongoing substance abuse unless it's actively being treated, people who are severely deconditioned and unable to participate in physical therapy or rehabilitation, and patients who exceed organ-specific weight limits. Transplant may be too risky if you have severe heart disease, if you have a decreased blood supply to your legs or internal organs, if you have advanced lung disease such as COPD, emphysema, or pulmonary hypertension, if you have severe hardening, blockages of the blood vessels, if you've had a serious stroke, or if you have an active or recent cancer other than skin cancer. Alternative treatments to the transplant are medically managing the complications of liver disease, such as ascites, getting paracentesis. If you have esophageal varices, making sure that those are getting banded, getting your EGDs as scheduled. If you have bleeding, managing the bleeding. If you have encephalopathy or confusion, managing that with medications. All these therapies can have significant side effects. You have the right to withdraw consent for transplantation at any time during the process. Let's review the liver transplant surgical procedure. The average surgery time is about 6 to 8 hours. It can be more or it could be less. It's not uncommon to have to go back to surgery after first coming out of surgery for the first time. Blood and blood products transfusions may be needed throughout the surgery. The steps to get to surgery are to first go under anesthesia. They'll place you on monitoring devices so they can monitor you throughout the surgery and after surgery. Your liver is removed and a new liver is connected. Just like with every major surgery, there are surgical risks of liver transplant. Complications are not common, but they can occur. You could develop a wound infection, pneumonia, blood clot formation, organ rejection, failure, and the need to retransplant, lifetime immunosuppressant therapy, arrhythmias and cardiovascular collapse, and multi-organ failure and death. There's also risks to having the transplant itself. We call these post-transplant risks. You could have a rejection, which is usually treatable without a threat to your life on a transplanted organ, but the liver can sometimes reject because it's foreign to your body, so we need to suppress your immune system with drugs we call immunosuppressants. So following the liver transplant, you'll be placed on these medications, and they will be lifelong to help reduce your risk of the organ rejection. You'll be at a greater risk of cancer, especially skin cancer and infection due to being on the immunosuppressant medications, and you will need to be seen frequently with lab draws to assess your liver and your kidney function as well as your immunosuppressant levels. The best way you can prevent rejection is by taking your transplant medications as prescribed and always getting your labs drawn. We also see some patients with psychosocial risks after transplant. Anxiety and depression are common following a transplant. Feeling overwhelmed is normal because of all the changes that are happening to you following the transplant. You may worry about rejection of your new organ. Grief is common after transplant as well. We just need you to be open and honest and communicate with us. You can always reach out to the team to determine if treatment is needed for any of the symptoms you're experiencing. Now we will review caregivers. Your caregiver is one of the most important parts of transplant. So what is a caregiver? It's a committed family member and/or a friend who will support you before, during, and after transplant. Your primary caregiver and backup caregiver will need to be identified and secured prior to being placed on the transplant waitlist. Caregivers will be included in all appointments so that they can also learn about the transplant process and support you through all aspects. Excellent caregiver support has shown to significantly increase the chances of positive outcomes. We want to make sure our caregivers are aware that each patient responds differently to transplant. Some heal rapidly and attain independent functioning quickly. Some patients may need some more dependence on their caregivers because they heal slowly and they need caregivers for an extended period of time. The responsibility of the caregiver will need to continue until the patient is completely and independently functional as determined by the multidisciplinary transplant team. This is usually 2 to 3 weeks, but may be longer. This can be a shared responsibility by several people, but support needs to be available 24 hours a day. Your caregiver's responsibilities during the hospitalization are to assist in getting you to the hospital for transplant, to provide updated contact information to hospital staff, to offer emotional support to patients during the entire transplant process, and to be available to participate in the discharge education that includes medication information and post-transplant home care. After discharge from the hospital, your caregiver will assist with medication management, make sure that you are eating and drinking properly, attend appointments and provide support during the recovery process, provide transportation to and from physician visits and the labs as driving will be restricted until given permission by a surgeon, provide physical and emotional support after transplant, and help to recognize the signs and symptoms of rejection and infection. Now a quick look at vaccinations. We recommend all vaccinations to be completed prior to the transplant. Your immune response is much better to vaccinations if they are done in this manner. After transplant, you'll be on those medications that suppress your immune system, making it easier for you to get an infection and more difficult to recover from that infection. The following vaccines are highly recommended: tetanus, diphtheria, and pertussis, hepatitis A and hepatitis B, pneumonia, the varicella virus or varicella zoster, the HPV, and seasonal influenza vaccines. I've mentioned the immunosuppression medications a few times. Let's go through them in a little more detail. Some facts about the immunosuppression medications. You'll be prescribed immunosuppression. We also call these anti-rejection medications to lower your immune system to prevent rejection. These immunosuppression medications start at the time of transplant and they will be taken for the lifetime of the transplant. The risks to taking immunosuppression medications are that we are lowering your immune system, which can increase your risk for complications. You can get infections, especially viral infections. We check you for the CMV virus and BK virus. You can get cancer, especially skin cancers we've seen after transplant, or a lymph node cancer, lymphoma, and the female genital tract, cervical, and vaginal cancer. It can also cause your white blood cell count to decrease, and there can be other drug-specific side effects. The pharmacist will go into more detail with you during her appointment with you about the medications and their side effects. But what you need to know about these immunosuppression medications is that you do not stop these drugs unless directed by the transplant team. If your insurance changes, you need to let us know because your ability to get these drugs can also change, so call us right away. You must take them as prescribed for the life of your transplant. If you stop taking these medications, your organ will be damaged. Only take medications approved by the transplant doctors because there may be side effects to the immunosuppression medications. Avoid supplements and herbal remedies. Now moving on to the transplant if you are approved. We need to make sure we're finding the right donor for you. The transplant team considers many factors when finding a donor that is a good match. Here are some of the factors that we consider. For donor characteristics, we look at the age of the donor, whether the donor is a DCD or a DBD, which I'll explain more on the next slide, the comorbid conditions that the donor may have, the size of the donor's liver in comparison to your body size, and the donor's blood type. Recipient characteristics we look at, this would be you, your MELD score, your blood type, your comorbid conditions, and your size. At AdventHealth Porter, we do not perform living donor liver transplants. So I'll go over the type of deceased donor transplants. There are two main types that we accept at AdventHealth. We accept a donation after cardiac death, the DCD I mentioned on the slide before, and a donation after brain death, the DBD. A donation after cardiac death meets criteria based on the heart stopping to beat and is removed from all supportive care. Then the donor is taken to the operating room to procure their organs. There's a period of time where the organs are not receiving blood. The donation after brain death is the donor meets criteria based on extensive brain death studies and can donate while the heart is still beating and the organs are still being perfused. Donors can also be placed at an at-risk category. This means that they are testing negative for hepatitis B, hepatitis C, and HIV, but may have been exposed to these viruses prior to their death, and so are not showing up on the tests. They also are patients that have been incarcerated, have had multiple sexual partners, have used IV drugs before their death, or were not able to provide a detailed social history. The surgeon will review all these donor offers and go over them with you prior to accepting the organ. There are a few ways to try to get transplanted faster. If you're willing to accept different types of organs, like the DCD, the donation from after cardiac death, or organs from a donor that has at-risk behaviors. You also have the option to multiple list. You have the right to be listed at more than one transplant center in the United States. And listing at a transplant center in more than one region may help increase your likelihood where you will get a transplant. You can discuss this type of organs that would be appropriate for you with your surgeon and your hepatologist. I previously mentioned a recipient's characteristics include the MELD score. MELD stands for the Model of End-Stage Liver Disease. It's a score that's calculated based on some of your lab values. The MELD score in relation to the UNOS wait list. If you are approved for transplant listing, your nurse coordinator will have you perform labs to check your MELD score. These labs will be drawn frequently based on your MELD score, sometimes up to weekly if your MELD score is high. It's a score utilized by the United Network of Organ Sharing to prioritize the need for transplant. In liver transplant, the sickest patient is typically transplanted first. Your score can range between 6 to 40, with 40 being the highest MELD score on the transplant list. MELD score can be modified with exception points based on UNOS guidelines for different diagnoses. What happens when you're on the wait list? You will either be listed as active or inactive. If you're listed active, all your testing is up to date. There are no problems if you were to get a transplant today. When your status is inactive, it means your testing is not up to date, or there's another reason that it wouldn't be safe for you to get a transplant today. You can get a call at any time once you're on the transplant list. Please make sure you have your voicemail set up and your messages cleared so you can accept calls or messages. And this phone call will also come from a 1-800 number, so make sure if you're listed for transplant active that you're answering all your phone calls. We always need to know how to reach you if you're active for transplant. We need to make sure we always have your current phone numbers for you and your caregivers. If we cannot reach you in a timely manner, we must let the organ go to the next patient on the list. Once you're on the waiting list, we need to make sure everything is staying up to date. You need to notify us if there's been changes as who can support you after the transplant. Notify us if you plan to go on vacation and wouldn't be able to come into the hospital for transplant. Let us know if your insurance changes. This is very important. If able, contact the transplant center before you change your insurers to make sure this will not impact your transplant coverage at our center. And please tell us as soon as possible about any changes in your health. We need to know if any new test results such as lab tests, heart tests, CAT scans, or MRIs are done. If you change your local doctor, or if you're on dialysis, if you change your unit. If you become sick and need antibiotics or hospital care, or any hospitalizations, please make sure you're notifying the transplant team. We want to make sure you're as healthy as possible while you're on the waiting list. So to ensure this, we want you to see your local doctors for routine physicals, colonoscopies as needed. For women, we want to make sure your mammograms and your pap smear tests are up to date. For men, we recommend a prostate exam, and then the vaccinations that are recommended to you by the pharmacist. You'll be required to be seen at our transplant clinic regularly while you're on the wait list. You'll have additional transplant education at these visits. We want to make sure you are ready for transplant and that you bring your support person with you. We also need you to see your dentist for routine exams. The hospital stay for transplant. Typically, you are in the intensive care unit for 1 to 2 days. The breathing tube that is placed prior to surgery is usually removed within 24 hours. Sometimes you'll see that the patient has soft wrist restraints in place. It's mainly so you don't pull any IVs or tubes out while you are coming out of anesthesia. Confusion is typical when you first wake up and the nurses know to give you pain medication. When you're ready, you'll be moved to the transplant unit and you'll be there for about 3 to 8 days. In most cases, you can eat and drink by day 2 to 3. You'll need to walk 4 to 6 times per day. This will help prevent some of those complications like pneumonia or blood clots. In some instances, you'll be discharged to a local hotel if we need you to remain close to the hospital for monitoring. These are the main follow-up instructions after a transplant. No driving until no longer using narcotic pain medications. You must be off pain medication during the day. You will need a driver to bring you to your appointments initially. No lifting more than 10 to 15 pounds for 4 to 6 weeks after transplant. To compare that, 10 pounds is like a gallon of milk. You may shower when you get home, but avoid anything where your incision would be soaking, like baths, pools, and hot tubs for 8 weeks. You will also be given parameters of when to call the transplant center. Fever greater than 101.5, persistent nausea or vomiting, unable to keep your medications down. You'll get blood pressure parameters and a pulse parameter of when to call. After you're discharged from the hospital, you will have frequent follow-up visits. If you live far away, we will need you to stay in town for at least 30 days after the transplant, sometimes less, sometimes more. Follow-up visits at the transplant center are generally for 1 to 3 weeks after transplant. You're seen twice a week, at least at months 3, 6, and 12, once every 6 months for 3 years, and then once a year for life. The transplant team will need to see you more frequently if there are any health concerns. And please note at all of these visits, you will need to have your labs checked. You should make an appointment with your regular doctor for other health issues that do not involve your transplant. As mentioned before, labs are very important after transplant to make sure you're not rejecting your organ. At the beginning, you'll have labs 2 to 3 times per week once you're discharged from the hospital. After that, labs can usually be drawn close to your home. There are certain labs that will need to be drawn at Porter, however. The frequency of lab draws will usually decrease over the first year, and labs will need to be drawn at the very least every 3 months for the rest of your life or the life of the transplant. Routine labs, again, are very important after an organ transplant. Without the labs, we cannot judge your health or the health of the transplant. So what happens after your visit today? The transplant team will meet to discuss the results from your evaluation. This will include everybody's evaluation of you and all of your testing. We will then decide if we recommend transplant as the right treatment for you. We will notify you and your referring doctor about the transplant team's decision. If you are approved for transplant listing, your nurse coordinator will guide you through the steps to take to be placed on the transplant list. If you are declined for transplant listing, your nurse coordinator will outline the reasons for denial and what other options you may have. And sometimes we need additional testing to make a decision to be approved for listing. Your nurse coordinator will also outline these items and place necessary orders to complete the additional testing. Thank you for being here today and listening to this education talk. If you have any questions, please be sure to ask them throughout the day.